And at the heart of the welfare state is the National Health Service, which has served us so well. And at the very beginning, it was a service free from the very beginning. We are here because of radical changes being proposed. Not all of them have been worked out, but to my mind, and to many other people, driven by insufficient funding. If you do not have sufficient funding to run something at the beginning, you're going to run into trouble sooner or later. And with that insufficient funding, there is a potential threat to the North Devon Hospital and the invaluable services that our hospital provided. Many in this room will have campaigned, in fact, for that hospital. And it means so much to us. And allied to that, of course, is the possibility of all the other services, in fact, serious possibility of all the ancillary services of health and welfare throughout North Devon. In fact, even our own medical centre seems to be under some threat because the funding stream there is different from other parts of the country and does not provide the sufficient funding we require. It's for that reason why the Parish Council thought we want to speak to a representative of the commissioning group, the NHS commissioning group, so that they would put their case, apparently where they're on a journey, and I'm told tonight that the journey is a progressing journey, and not all questions will be answered maybe to your satisfaction. But nevertheless, this is your chance to put those questions which worry you about our hospital, about the ancillary services, and indeed what may be the future of our medical services in Braunton.
Can you hear me if I speak without the microphone?
No.
Okay, I'll use the microphone. Good evening, ladies and gentlemen. My name is Laura Nicholas. I'm the Director of Strategy for North, East, West and Devon CCG. And first of all, can I apologise for keeping you waiting and for being late? I'm afraid it took me rather longer to get here than I'd anticipated, so I apologise for that. Tonight, I've come to talk to you about the public consultation that is currently underway across Devon. And it concerns mainly proposed changes to the numbers of beds that we have and the locations of beds in Eastern Devon in particular. So if people were coming tonight thinking that I was going to be talking to you in detail about proposals that relate to acute services in Barnstable, I'm afraid that isn't the case. I will be able to answer some questions, but the focus of the consultation work that we're undertaking at the moment is around East Devon. Now, I'll take you through the presentation, which is what we've gone through in all of our public meetings on these particular proposals, and you're very welcome at the end to ask questions. As I've said, I think if you have other questions that relate to acute services, there will be a limited, there's a limit to which I'll be able to answer some of those, but I'll do my best in terms of telling you where we are with all of that. So I suppose it'd just be worth checking in the room by a show of hands. Are you happy for me to go through the presentation which talks about the community beds in Eastern Devon? Or are people all here sitting here thinking that they're going to talk about something else?
Yes.
Do you want the Eastern Devon presentation? No, I didn't think you did. Okay.
Basically, may I just interrupt for a second? Basically, this is not a consultation meeting.
No, it's not. I was invited to a parish council meeting to talk about the consultation that we're undertaking. So the consultation that we're currently undertaking is about community hospital beds in Eastern Devon. I know that there are a lot of other concerns around North Devon, but that's not the subject of the consultation meeting that's not the subject of the consultation that we're currently undertaking.
Apologies, but I'm leaving. This is a PR exercise. My point is,
speak. Sir?
In the email that we had with CCG, it was to invite them to a public meeting tonight to talk about the cut to the NHS that will affect this community. And it was a public meeting that was invited to.
Okay, so I'm happy to take other questions, but the public meetings and the public consultation that we're currently conducting is around the changes to Eastern Devon.
Excuse me, can I have a word?
People are just talking. Other people put their hands up like
Yes,
you're doing
yes,
a
good.
meeting, and that's being
I'll
ignored.
take over now,
Sorry.
okay? I'll do my job. I'll start with the lady, please, then you Richard and the gentleman in the back.
Is there any relevance to what you are going to talk about?
So there is some broader context that that will help to explain some of the changes that may happen in the future. So it may be worth me going through that presentation really quickly in terms of providing a broader context. But the specific proposals that we're putting forward will not impact this community as regards this.
Okay. Richard?
Excuse me. You're the...
Director of Strategy for New Devon CCG.
Okay. Did you not see the email?
Yes, and I can talk about. I'm not trying to avoid your questions.
I mean, did you not see the email and don't you feel you had a wasted journey?
I may well have done.
But hang on, there's a certain expectation reflected in the audience here, and you've disappointed this audience.
Well, we haven't started yet, to be fair, and as I said, I am willing to take questions. My opening question was, is it useful to talk about the public consultation that is underway, that isn't impacting on your community? If the answer to that is no, I won't go through the presentation. I will try and answer other
Then
questions.
you forgive me if I say that this is one of the biggest sidesteps I've ever seen in attending public meetings. You've actually come here with something that doesn't represent this community.
The wider aspects of what we're trying to change do affect this community as we go forward, but it's in a much wider context than the consultation that we're currently undertaking.
Yeah, well, thanks for coming, but could you tell us when there's likely to be a meeting where you will talk about the North Devon District Hospital, so as we know what's going on?
Okay, let me talk to you about the acute services review. So people may have heard the term in the media, sustainability and transformation plans. These are big strategic plans that are currently in development in every part of the country, and New Devon is no different. We are working alongside South Devon and Torbay as part of a planning footprint, and we have developed some strategic plans. The context for those plans is the issues that we face across Devon around clinical sustainability of services and financial sustainability of services. If we continue in New Devon to spend money at the rate that we're currently spending it, by 2021 Devon will be £400 million in deficit, and we won't be allowed to carry that level of overspend. So the Sustainability and Transformation Plan and the Case for Change that was published back in February start to set out how, as an NHS family, we will start to address some of the challenges to meet the future sustainability of services and be able to afford to deliver care to an ageing population, which is also increasing in its level of demand. Some of the key proposals that we are working on that will help us to deliver those changes are, first of all, a change to the way that we deliver care, the model of care that we currently offer. At the moment, there are around 500 or 600 people in a bed any one day, at any one time on an individual day, who don't actually need to be in a bed. And what's missing for them are the community and primary care services and the social care services that would enable them to be discharged more quickly or to stay at home in the first place. So one of the key aspects of the proposals that we're developing relates to reducing numbers of beds in order to fund community services, primary care services that will allow people to be cared for in their homes. The financials of that also enable us to provide care to a larger proportion of people. And you will have seen some of the early stages of those changes in Northern Devon through the changes around Holsworthy, for instance, and Torrington. And we have done that in conjunction with staff at North Devon District Hospital as part of the Transforming Community Services programme. And we came and consulted with you on that about 18 months ago. The work that I'm talking about now is the next stage of that, and we're proposing to effectively replicate the model of care that we've implemented in North Devon in Eastern Devon, who at the moment have significantly more community hospital beds than this part of the county does. So that's the heart of the public consultation that we're currently undertaking. Alongside that, there are other plans that are in the pipeline. Some of those plans relate to acute services, and we have a range of services that we are looking at. The services that we are going to start developing proposals for in the first instance are stroke services, maternity services including neonates and paediatrics, and urgent and emergency services. Now, the rationale for undertaking the acute services is much more focused, less around how we provide more effective care at less cost, and much more focused around the clinical sustainability and viability of services going forward. Some of these services across Devon, and when I say across Devon, we're looking at acute services in all of the district hospitals, so that includes Plymouth, the RD&E, South Devon and Torbay Hospital, as well as Barnstable, in order to make sure that going forward we can provide services that are both safe and sustainable clinically. Now, that is likely to lead to some changes. What these proposals are not likely to do is be articulating wholesale changes to Barnstable Hospital. This work has only just begun, so that we don't know what the outcome of those proposals is going to be. We're collecting data, we're talking to clinicians, we're understanding what public needs are, we're talking to other staff, and we're looking at wider evidence both from elsewhere in the UK and indeed internationally to help us to understand how we can consistently meet standards of care. Some of the issues that we face at the moment are difficulty in recruiting specialist medical staff, particularly to smaller sites, which means that those that are left providing the services sometimes can't, for instance, run a safe rota of cover for those services 24/7. Some of the reasons we have difficulty recruiting is that we have an increasing level of specialisation in the NHS. Consultant medical staff will sometimes spend up to 15 years learning their craft, and they want to be able to use those very specialist skills. And the opportunities to do that in smaller sites with smaller teams of consultants is actually lessened, which makes it quite hard to recruit staff of the right calibre to ensure that we can continue to provide services. In addition to that, when you have got services running, in order for those clinicians to be able to maintain their skills, they need to have a certain number of patients going through of particular sorts, of particular types of condition, in order for them to be able to be competent to practice their clinical skills. That's also a challenge for some smaller specialties in some smaller hospitals. Those are some of the issues that we're trying to resolve. We also need to make sure that we maintain a good level of access to services, and I know this is at the heart of some of the concerns that you have as a community, and what might happen in the future. There is undoubtedly, at times, the need for a trade-off between looking at how you access a service and then how safe and sustainable that service is. And the proposals that we come up with will have a clear set of criteria which help to articulate to you, the public, how we might arrive at a decision about what changes to services are necessary. So, as I said, we will be applying that methodology to be looking at stroke services to start with, maternity and neonatology and paediatrics, but then also moving on to urgent and emergency services. There are also some services that are vulnerable because they are simply small, and the volumes of activity, the numbers of patients going through those services are by definition small. And in order for them to be clinically sustainable, for the reasons that I've already given, we may need to make some changes about around where they're provided and the extent to which they may need to be linked into other services. So just to give you an idea in terms of how this may relate to Barnstable, and this is a hypothetical scenario. There are no proposals on the table yet, but the sorts of things that we think we will need to look at will be how we might make sure that services can still be provided in Barnstable, but they will need to be linked probably to services in a different location, maybe Exeter, maybe even Taunton, we don't know yet. The point is that we do understand, and we have evidence to show this, that North Devon District Hospital is the smallest and most rural district general hospital in the country. That does give it something of a special status. That does mean that we do need to consider the trade-off between clinical services and where we provide them and how readily people can access them. Which means that we will need to look at, is it feasible for us to provide services that if we were looking in a different part of the geography or a different part of the country, actually wouldn't be viable because there is not the volume of activity or patients, or it's difficult to attract workforce to provide. But because it's Devon, because it's North Devon, and because it's remote, we may need to make decisions about continuing those services because it's not safe to move patients to a different location. However, the reverse may also be true. In some situations, clinicians agree that it is clinically appropriate and safer to drive past the door of your nearest district hospital and go to somewhere where the specialist skills and where the consultant medical staff who have the right skills, who have the right rotas and the right workforce in place can more ably look after people. And actually, what that also means, it's not just about journey time, it's also about the capability of services like the ambulance service. So there's been very many changes in the way that patients can be transferred now from how it was, let's say, 10 or 15 years ago. What paramedics can do, what doctors travelling with patients can do is vastly improved since in the last 10 or 15 years. And that does mean that on balance it is sometimes safer for people to travel further for the emergency care that they need. It is not always the case. The point is the proposals will need to examine those alternatives and put that case to the public with our proposals for any changes that we make. I should point out that we're not looking at a wholesale review of Barnstable Hospital per se. It is pretty clear from the evidence that we do have that a reasonable range of services needs to be maintained within Northern Devon.
At some point, you could just stop. You're asking us to take an awful lot of things at one go. I do know.
Excuse me, can I ask a question, please?
Yes, that's what I'm just coming to. Yeah.
I've just listened to what you said, and you don't seem to be aware of you might have a formula, I don't know, but you're saying it's easy to go past Barnstable to Exeter. Have you taken into account all the hundreds of houses that are being built in this area now? Multiply that by probably an average of 4 people in each house. Have you taken that into account? Can you tell me that?
So at this point I would say no to that because the proposals have only just started. The work to develop the proposals has only just started.
Right.
But will we take account of demographic information and the forward look in terms of what populations will be like in 5 or 10 years' time? Then the answer is yes, we will do that.
If you're saying that Barnstable, North Devon District Hospital is a small hospital, it's the only hospital in the North Devon area that uses mobility, and if you're saying you can't get enough the clinically staff that are suitable, where are we going to get all these extra clinical people who can simply take someone from here to actually have
So,
very regularly anyway. And there are like, for example, a week ago, the link was closed due to learning at Tiverton. We've had learning here. How are people supposed to get there when in that situation? How many helicopters that you bring in? You know, it's ridiculous. The cost of a helicopter to drive them from here to somewhere where they safely treated is going to cost a hell of a lot more than trying to make the North Devon District Hospital viable for the people who live here. Plus, we have a huge influx of visitors from all over the country in our area. You know, if you live in Birmingham, there are loads of holiday makers come in. Plus, your access to the hospitals is much closer. North Devon is unique in the fact that geographically there is a high amount of people who use our services that don't live here.
so I don't disagree with any of those observations. Those are all things that will need to be worked through as we develop the proposals and before we make any decisions. Clearly, before we were to make any further changes to services, we need to make sure that we have alternative staffing in place, and the ability